Good afternoon, New Brunswick, and welcome to today's COVID-19 update for the province with Dr. Jennifer Russell and Minister of Health Dorothy Shepherd. I'm Vicki Hogarth at the CHCO News Desk. We should be starting on time today, but actually, as you know, it's starting at 2 o'clock today instead of the usual 2:30 time. So we should be just a few minutes away from when we are about to begin. So let's just do a recap so we know where we're at in terms of numbers for the province before we begin and when Dr. Russell will give us the new case count for today. Yesterday, there were 27 new cases of COVID-19 in the province. 11 of those cases were in Zone 1, that's the Moncton region. 2 cases were in Zone 2, that's the St. John region, and 14 of the cases were in Zone 4, the Edmundston region, which continues to be on lockdown, and we know that lockdown will be continuing for at least another week. There are still some journalists joining the line. We are going to be quite a big press conference today in terms of the journalist turnout, so I have a feeling it will probably be just one question each from each journalist, but if you are looking for answers to certain questions, if you're watching online right now on Facebook, there's almost 700 of you already. Please feel free to write your questions in the comment section. I received a lot of emails, a lot of Facebook messages this week with questions from the public, and I really appreciate it. They help me decide what to ask each conference, and sometimes I do, as I've mentioned before, try to get you answers outside of the conference if it's not something I'm able to ask in the conference. And Premier Higgs, as we know, his mother passed away this week. He is not joining us today. And I do have some questions particularly related to Campbellton Island for the Premier, so I hope to get to those questions when he joins us in the next conference. As we all know, next week we'll see the end to the Campbellton ferry as far as we know. It hasn't been extended any further. I don't know if weather permitting it's able to, and there were new travel restrictions that we saw in place that this week that make things even more complicated for residents of Campbellton Island. For instance, the school children are unable to do extracurricular activities with other schools due to having to travel through Maine when there's no ferry. So there are a lot of questions I have regarding Campbellton. I'm not ignoring them or forgetting. Most of you I have sent a response to who have been able to reach out with those questions. I just don't know when I'll be able to get an answer for them, hopefully sometime next week, but they are in the back of my mind and something I care about deeply, and I might even try to take a ferry over this week, if at all possible, one of the last ferries, depending on how the weather is. So they're not forgotten, they're in the back of my mind, they're on papers beside me. I just don't know when I'll have a chance to ask those particular questions. So just for a recap, before we get the new case count from Dr. Russell, there are currently 313 active cases of COVID-19 in the province, and how that breaks down in terms of zones. There's 77 in Zone 1, and as we know, Zone 1 is the Moncton region. It's still in the red level of recovery. Zone 2 and Zone 3 move back to the orange level Tuesday at midnight. We are starting in 1 minute. If you can hear Bruce, let's just take a minute to hear what Bruce has to say. He says we're starting in 1 minute, so 1 second. Okay, so we should be starting in 1 minute, so that's right on time today. I'll go back over those breakdown of active cases. 77 in Zone 1, which is still in the red level of recovery. 35 in Zone 2, 32 in Zone 3. Now both those levels, as I just mentioned, move back from red to the orange level of recovery at midnight on Tuesday. Zone 4 is still in lockdown with 152 active cases. There are 9 active cases in Zone 5, 6 in Zone 6, and 2 in Zone 7. Now, I know there's a lot of speculation about whether Zones 5, 6, and 7, who've been doing quite well after the holidays compared to the other zones, will be moving back to yellow at any time soon. I haven't heard anything about... Oops, we're starting right now. I will be joining you right after the conference. Oh, Bruce is still... Here we go. I'll see you after.
Tout le monde est bienvenu à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Dorothy Shepherd, Ministre de la Santé. Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the Chief Medical Officer of Health for New Brunswick, and the Honorable Dorothy Shepherd, Minister of Health. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Avant de commencer, je voulais juste remercier tous les gens qui travaillent dans les rôles techniques. Alors, les gens qui font le son, les gens qui font la traduction, les gens qui sont les interprètes. I just wanted to thank everybody on the technical side who have been working so diligently since the beginning of this pandemic. Today marks the 1-year anniversary of our first press conference for the pandemic. And I just wanted to thank the interpreters, the translators, and all of the technical team who support us in putting these presentations together, and the comms teams, etc. Can you please put your microphones on mute, though? I just heard somebody online. Thank you. So as I just mentioned, a year has now passed since the first cases of COVID-19 were reported in Canada. And when the pandemic began, we have a lot of learning to do, but I think I was pretty clear about the fact that we were going to have to look at restrictions, lift restrictions based on data, and then put restrictions in place as needed. And that we would continue to do this until the vaccines arrived in sufficient quantity to have herd immunity. And I think, at this 1-year anniversary, I think it's very significant to say that we have really come through this first year quite successfully with respect to the number of cases, hospitalizations, and deaths in terms of the seriousness of what we've seen. And just to compare that to the numbers of flu that we normally see, and again, I know we have time constraints today, so I don't want to take up extra time, but I just think it's very, very important to note that the information that we have on flu numbers and numbers of people hospitalized over the last year. Oh, I thought I had that data. Well, all that to say is that this time last year, with respect to the flu, we would have had many, many, many hospitalizations, many, many ICU admissions, and probably many deaths by this time. I think we have on average about 30 deaths per year from the flu. But just to say that we've learned so much about COVID-19 in the last year, and as we move forward today, we have new challenges, and I do want to talk about some of those challenges in a transparent way, because they are different than the challenges that we've lived with for the last year. And not just a little bit different, but quite dramatically different. Notre objectif a toujours été de trouver un juste équilibre entre la liberté personnelle et la protection de la santé publique. Nous comprenons de plus en plus cette maladie au fur et à mesure que nous avançons dans la pandémie. Nous apprenons les leçons et nous améliorons. Our goal has always been to strike the right balance between personal freedom and protecting public health. Like everyone in the world, we are making adjustments as we learn more about the virus. And today I'd like to explain the next steps we will be taking in our approach and why. Because things have changed dramatically in the world, and those changes are a result of new strains or variants. So every year, as you know, we have different strains and variants of the flu, and therefore we get a new flu vaccine every year that matches those variants. So right now we're experiencing changes in the COVID-19 virus such that we are seeing new variants and new strains. And because we have these new variants, again, we have to learn and get better with the information that we are using around these new variants. And we have to acknowledge that in order to control the virus, we do have to acknowledge this new information. So we're not really controlling what's happening in the pandemic. The virus is controlling what's happening in the pandemic. So not public health, not the government, not your family or your neighbors, but the virus itself is controlling what happens during this pandemic. And right now, because of those variants, there's 4 in particular we're concerned about right now, and there will be more. We have the UK variant that's been in the UK since December. It went through the entire country within 6 weeks. We have the African variants, which are now circulating in BC in community transmission. The UK variant is in Ontario, and there's community transmission of that one as well. These are much more transmissible. They're much more contagious. They infect way more people. So that is the challenge we're facing now. I would say we went through the first wave unscathed. We've come through the second wave almost, not quite. We're getting there. We still have a zone in lockdown right now and another zone in red. But I would say that we are in the middle of the second wave right now. But the third wave is going to be upon us very soon, and that third wave is much worse than the first and second combined. And this third wave is as a result of these new, more transmissible, more contagious variants or strains. So that means it's more dangerous. And therefore, as we speak, again, they are going to come to New Brunswick if they're not already here. We do have a mechanism to test for those variants, and we will be, and we do. But again, they'll arrive without us knowing, and it'll be a week or two before we find that out. So that's why we're preparing now. It will spread more quickly. It will outrun our ability to contact trace and isolate. Déjà 3 variants distincts de la COVID-19 ont été décelés au Canada. Ils s'infiltreront au Nouveau-Brunswick si ce n'est pas déjà fait. Ces souches ont un degré de transmissibilité d'environ 30 à 70% plus élevé que la forme initiale du virus. Ainsi, le virus se répandra plus facilement et plus rapidement, dépassant notre capacité à effectuer la recherche des contacts pour s'assurer que les personnes exposées s'isolent. And that is why I do need people to download the app. So that is one of the things that will help us in the future. In Great Britain, as I mentioned, the variants were first detected, and back in December we heard about them, and they spread across the country in 6 weeks. So most of the United Kingdom, and there are 30 countries, most of the United Kingdom right now is in lockdown and will remain in lockdown until at least March. And there are 30 countries now in Europe who have the UK variants. And as I said, the new variants are in Canada, and they are causing a lot of harm. There was a recent outbreak in an Ontario nursing home, and it was identified that it was the new COVID-19 strain, the UK strain, that resulted in nearly every resident and every staff being infected in a very, very short amount of time. So there would be no time for isolating and serial testing in that type of facility, in that type of setting with that variant. And 47 residents actually passed away. That is more deaths than New Brunswick has seen in the entire pandemic in just one facility. So it's very sobering. It's a very somber piece of information that I'm sharing with you, but I need to, because this is why we are taking the steps that we are taking right now with respect to travel restrictions and self-isolation and public health advice and phases. So we have to protect our most vulnerable citizens. That's always been the case throughout the pandemic. Protect our vulnerable populations, protect our healthcare system from being overwhelmed. And that is what we're seeing in other provinces across the country, and that is what we're seeing in other jurisdictions. We have to adapt our strategies to respond to these new dangers that are posed by these variants and strains that are much, much more serious, much more dangerous, and much more difficult to control. So the zones that are at the orange alert are going to remain at the orange alert for several more weeks. And I know this is not the information that people wanted to hear, but we are making changes to the orange phase so that you will understand that it's not this, you will have one household bubble plus 10 more people that you can interact with, but it has to be the consistent number 10. So your steady 10. We had steady 20 in yellow, now it's going to be steady 10 in orange. No region in this province can move past the orange level until we have a clear understanding of the impact of these variants. Les zones qui se trouvent présentement à la phase d'alerte orange demeureront à la phase orange pendant plusieurs semaines encore. Aucune région de la province passera à la phase orange, de la phase orange, à une phase moins restrictive avant que nous puissions comprendre clairement les répercussions de ces nouveaux variants. And I know this is bad news. La bonne nouvelle, c'est que nous apportons les modifications aux restrictions de la phase orange afin de trouver un juste équilibre. Ces modifications feront en sorte qu'il sera plus facile pour vous de voir les membres de votre famille et des amis sans toutefois compromettre notre lutte contre ce virus. Nous demandons à chaque ménage de dresser une liste de 10 personnes que ses membres peuvent fréquenter à l'extérieur de leur bulle d'un seul ménage, soit les mêmes 10. Alors, à la phase jaune, c'était les mêmes 20. Phase orange va être les mêmes 10. Pour pouvoir les fréquenter, vous devrez aussi figurer sur leur liste. So, the good news, to maintain a proper balance. Again, we've made these changes to the orange alert level so that you can see your family and friends in a way that won't compromise our fight against this virus. So keep a list of those 10 contacts that you will see consistently outside of your single household bubble, your steady 10. You have to be on their list, though. If you're going to see them and they're going to see you, you have to be on each other's list of 10. If we all keep to a consistent 10 of close contacts outside of our home, we will reduce the risk of rapid spread to COVID-19 and make it easier to trace contacts when infection happens. It's not going to stop the transmission. We're hoping to slow it down. This number will enable people to protect themselves and their families against the virus while maintaining contact with others, which is vital for preserving our mental health. Other aspects of the orange alert level will stay the same. Les autres conditions imposées par la phase d'alerte orange demeureront les mêmes. These limits will present hardships for many. How do you choose among your closest family and friends? It's not easy, and we don't expect that everyone will be able to adapt overnight. Nous avons appris une dure leçon après le temps des fêtes en ce qui concerne les risques causés par les grands rassemblements. Nous ne pouvons pas nous permettre de commettre les mêmes erreurs à l'approche du congé de mars. Again, some of those gatherings that happened over the holiday season occurred when people attended who had symptoms. Nobody should be going anywhere if they have symptoms. You need to stay home and get tested for COVID-19. We need your support. We need your cooperation with all of these guidelines if we are going to keep our province on track in the face of these new strains. We learned a hard lesson over Christmas about risks of gatherings, especially, again, if people attend with symptoms. We can't afford to have those things happen, especially with March break approaching. I am asking you now, please do not make plans that will take you outside of your zone. We do have to limit our movements as much as possible. We do have to limit our contacts. So just because I'm saying you can have 10 consistent close contacts outside your household bubble, it doesn't mean that you should have 10. I'm saying that would be the limit that I would want you to have. Each one of those will be a close contact if one member of your household tests positive for COVID-19, and so they will be self-isolating as a result. To further limit the opportunity for these new variants, these new strains to spread in our province, we have to begin to have new rules for people who travel for work outside of New Brunswick. And I know this is a hardship as well. I've received many, many emails from people that is causing a hardship. We understand the importance that these jobs play in our economy, rotational workers who work in other provinces in New Brunswick and across Canada. We are seeking a balance between maintaining the economy and protecting the health of New Brunswickers, and this is always going to be a challenge. Les travailleurs en rotation peuvent s'isoler avec leur famille pendant qu'ils sont au Nouveau-Brunswick. Cependant, la famille en entier doit s'isoler pendant 14 jours. Si à n'importe quel moment un membre de la famille ressent des symptômes de la COVID-19 et obtient un résultat positif à un test de dépistage, la période d'isolement de 14 jours recommence à zéro. This was a surprise for people at Christmas when they were trying to self-isolate with their families. They weren't expecting that if one person in the household tested positive, that the reset button would be then, and they would all have to self-isolate for another 14 days. But that's what I'm trying to explain to you now, if that's the route that you take. Je comprends que ces nouvelles mesures causeront des difficultés pour de nombreux citoyens de la province. Ideally, rotational workers should self-isolate in a separate place like a hotel or a granny suite. If they absolutely cannot, rotational workers are permitted to self-isolate with their families while they are in New Brunswick. However, the entire family needs to self-isolate for the full 14 days, and if at any point a household member develops symptoms and tests positive for COVID-19, that 14-day isolation period starts again. I do understand these difficulties. These are challenges we are facing together as a province. In the weeks ahead, we do have to look after each other, and we do have to look after ourselves. I am going to start going through the list of the new cases now. Depuis notre dernière conférence de presse, 3 personnes du Nouveau-Brunswick sont décédées de causes liées à COVID-19. Il y a donc eu 17 décès liés à la COVID-19 dans la province depuis le début de la pandémie. Le plus récent décès est une personne âgée de 80 à 99 ans, décédée de problèmes de santé sous-jacents, y compris la COVID-19. Cette personne résidait au manoir Bellevue, un foyer de soins à Edmundston. Since our last briefing, 3 New Brunswickers have lost their lives from the effects of COVID-19. We have now had 17 COVID-related deaths since the pandemic began. The most recent death is an individual aged 80 to 89 who died yesterday as a result of underlying complications, including COVID-19. This person was a resident of Manoir Bellevue, a nursing home in Edmundston. And Public Health is also investigating a recent death at the Parkland St. John long-term care facility to determine if it is a result of COVID-19. Each of these deaths comes with such grief. The family and friends need our condolences and need our support in their grief and bereavement. Aujourd'hui, il y a 16 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Il y a 4 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 3, soit la région de Fredericton et la vallée de la rivière Saint-John, il y a 3 nouveaux cas. Il y a 9 nouveaux cas dans la zone 4, soit la région d'Edmundston, de Grand-Sault et de Saint-Quentin. Il y a un nouveau cas dans la zone 6, soit la région de Bathurst et la péninsule acadienne. Toutes ces personnes s'isolent à l'heure actuelle et la cause de ces nouveaux cas fait toujours l'objet d'une enquête. Il y a présentement 313 cas actifs de COVID-19 dans la province. 4 personnes ayant contracté la COVID-19 sont présentement hospitalisées, dont 2 aux soins intensifs. Today, there are 16 new cases of COVID-19 in New Brunswick. Zone 1, which is Moncton, southeastern New Brunswick, there are 4 new cases. In Zone 3, which is Fredericton and the St. John River Valley, there are 3 new cases. In Zone 4, which is the Edmundston, Grand Falls, Saint-Quentin area, there are 9 new cases. In Zone 6, which is Bathurst and the Acadian Peninsula, there is 1 new case. Each of these individuals is self-isolating, and the cause of these new cases is under investigation. There are now 313 active cases of COVID-19 in our province. 4 of these cases are currently in hospital, including 2 in intensive care. Please keep these people and everyone in New Brunswick whose lives have been touched by COVID-19 in your thoughts and your prayers. And again, I know that the pandemic has presented challenges to our physical and mental health, and none of us are immune to this. So please support your friends and family, and if you need support, please reach out to your family and friends. Thank you for your time today, and I know that if we work together, we can get through the next phase of this pandemic. Thank you very much. Merci.
Thank you, Bruce, Dr. Russell. Good afternoon, bonjour. Today, we have learned of an individual in Zone 4, the Edmundston region, has passed away as a result of COVID-19. I wish to express my sincere condolences to the family and friends of this individual. Since our last news conference on Monday, we have lost 2 other people to COVID-19 as well. On behalf of all New Brunswickers, I want to share my heartfelt condolences with the loved ones of these 2 individuals. We are very sorry for the losses these families have experienced. Since last March, we have all had to make drastic changes to the way we live our lives. The situation and the virus itself have continuously evolved, and we have all had to evolve with it. That has meant that the rules in place have changed numerous times since last spring. Our government has done everything in our power to provide New Brunswickers with as much freedom as possible, while still slowing the spread and protecting our most vulnerable residents. This is a fine balancing act. I know the changes to the rules can be frustrating and difficult to keep up with. I am asking you to continue to be adaptable as we strive to stay one step ahead of COVID-19. Because of the potential risks posed by COVID-19 variants, as Dr. Russell has explained, as well as the need to get as many New Brunswickers vaccinated as soon as possible, we are taking public health advice, and we will not be moving any zones to the yellow alert level for now. I understand many New Brunswickers will be disappointed by this news, particularly in those zones 5, 6, and 7, where case numbers remain low. But right now, the risk is simply too high. We risk putting zone after zone into lockdown to battle increasing numbers of infections, hospitalizations, and deaths. After meeting with Cabinet and the All-Party Cabinet Committee on COVID-19, we are following the advice of Public Health and introducing a change to the orange level. As Dr. Russell explained, starting at midnight tonight, residents in orange zones will be able to spend time with up to 10 people outside of their household. To be clear, that means your entire household can choose a consistent, steady 10 to spend time with. And the 10 people you choose cannot change from one week to the next. You will be allowed to go into public places that remain open under orange level with these 10 people, including dining out in restaurants. Restaurants must continue to keep a list of names and contact numbers of all diners to assist with contact tracing, as they have done during the yellow level. We know people need to see their families and close friends, but please continue to keep your numbers of contacts as low as possible. This change allows some greater freedom in the orange level, but keeping contact numbers low will make contact tracing easier if someone becomes infected. Travel between zones continues to be discouraged, as the more people move around, the more the virus is able to spread. And as Dr. Russell mentioned, strict isolation guidelines for those coming into the province remain in place so we can continue to reduce the risk. I know I'm repeating what Dr. Russell has already explained, but this is very important. And as we know, there is a high risk of the virus coming in from outside the province. Anyone entering New Brunswick, including rotational workers, must complete a 14-day self-isolation away from others, preferably in a hotel, granny suite, or detached apartment. There are few exceptions, which you can find on the Government of NB coronavirus website. If, as an absolute last resort, you must isolate with other people, everyone in the household must also complete a 14-day isolation. That means everyone in the home stays in the home and cannot go to work, school, or anywhere else unless there is a medical emergency. We highly recommend you do your best to find another option, as this puts everyone in the home at risk. Time and time again during the pandemic, we have seen incidents where a family became infected while a member of the household was isolating. In addition, if anyone in the home develops symptoms, they must get tested, and everyone in the household must begin their 14-day isolation again from the beginning if there is a positive case. These rules are strict. They are painful. They are necessary. We need to buy time and reduce the number of contacts of those coming into the province who could potentially be infected with COVID-19. These are not decisions we have made lightly. We took into consideration the risk of the COVID-19 variants, combined with the need to vaccinate our population, and realized we had two choices. We could loosen border restrictions and rely on regular lockdowns to slow the spread, or we could tighten our borders and give New Brunswickers more freedom within the province and hopefully get back to having an Atlantic bubble. After much thought and deliberation, it was clear that the second choice was the right choice. We must now focus on moving Zone 4, the Edmundston region, and Zone 1, the Moncton region, back to orange. For now, Zone 4 remains in lockdown, and Zone 1 is in the red level. We will have a new recovery graphic available on our website and on social media, and I know the media has shared these images in the past as well. It will outline the differences between lockdown, red level, and orange level, the levels New Brunswick zones are currently in. Yellow will not be represented on the graphic. We are working with public health to reassess the restrictions under yellow level to determine whether we need to make further changes to that level of recovery to deal with the changing reality of the pandemic. We expect orange will be our status quo for at least the next little while. I know that means disappointment and frustration for many, but the alternative was simply not a responsible option. We are all feeling fatigue as this pandemic continues. Like all of you, I look forward to the day when the majority of the population is vaccinated and we can return to a more normal way of life. I hope the change to single household bubbles in orange level zones will give everyone something to look forward to as we continue to deal with this situation. Let's work together to get the entire province back to this level. As Winston Churchill famously said in the midst of the Second World War, this is not the end. It is not even the beginning of the end, but it is perhaps the end of the beginning. This is a war against a virus, and we are all in this together. If we all do our part and follow the rules, all New Brunswickers will soon be able to reconnect safely with a few of our closest friends and family members. Thank you for your help. Merci.
Thank you, Minister. Thank you, Dr. Russell. Merci beaucoup, Ministre Shepherd, Dr. Russell. On va maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question. Voulez-vous assurer de désactiver le son de vos micros? We'll now proceed with questions from members of the media. Each reporter will have one question, and you have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Mia Urquhart, CBC.
Thanks, Bruce. My question is for Dr. Russell. If all employers are required to mandate physical distancing and masking in the workplace, how is it possible that 28 workers at the Nadeau plant would contract the virus? We know the spread in special care homes is expected to be more likely, but at a poultry plant, is this an acceptable risk or a failure in applying health guidelines?
Well, I haven't been involved directly with the regional staff's investigation. So we know that throughout the province, we've had the help of WorkSafe and we've had the help of Department of Public Safety to do checks on different businesses to make sure that they have operational plans, et cetera. So all I can say is that the process that's supposed to be followed is they have an operational plan that involves physical distancing and masking, et cetera. And again, we do have the ability to have WorkSafe help us with respect to doing checks on these organizations and businesses to make sure they're complying. And if they aren't, then they are provided with information on how to do so. And in some cases, there have been fines given, et cetera. Do you want to add anything, Minister Shepherd?
No, just very quickly, Dr. Russell is pretty accurate. We don't know the situation of the Nadeau plant, and things are still under investigation, but there will be a full review of all of the policies at any plant that has an infection.
Thank you. Silas Brown, Global TV.
Hi there. Just trying to understand the new orange phase rules. Looking at this, it would seem, just for a quick example, if you are partnering with another group of people, you need to be on each other's list let's say the second group is partnered with a third group, that third group would not have to be on the first group's list, right? I'm just trying to get an idea and kind of asking really, although you're opening up contacts, it seems like it opens up quite a lot of other potential contacts. Is that correct?
So it's not as big a contact list as we had over the Christmas holidays and New Year's. So if I'm on Dr. Russell's list, then she is, if I'm on Dr. Russell's list, then she is on my list, taking up one position on each list. So it is important that it be a maximum of 10 people per household bubble.
Thank you. Laura Lau, CTV.
Hi, thank you, Bruce. This question would be, I believe, for Dr. Russell. Earlier this week, there was talk about moving zones 5, 6, and 7 to yellow sometime this week. What exactly has changed to keep those zones in the orange level, even though, as was mentioned, their case numbers are relatively very low?
I'm going to take that one. So the presentation that Public Health did with the COVID Cabinet Committee and to Cabinet clearly showed that we need to have a way to manage the risks that are coming and that actually, quite frankly, are here. And so we know that there is always talk of taking zones to the lighter color phase of yellow. But it is really important, and that's why we wanted to be very clear in delivering the message today. We understand the disappointment, but this is a very necessary decision, not unlike the one we took last March to actually lock down the entire province. This is of the same severity.
Thank you. Sophie Desautels, Radio-Canada.
Sophie.
Héloïse Rodriguez-Quilibache, Radio-Canada.
Oui, bonjour. J'aimerais avoir votre réaction, ministre Shepherd, à la décision du gouvernement Trudeau de resserrer les frontières fédérales. Quel genre d'impact vous pensez que ça va avoir peut-être sur la progression du virus au Nouveau-Brunswick également?
Per question, could you confirm what you're actually asking? Are you asking about the travel restrictions that the federal government has requested?
Hi, yeah, that was my question. I wanted to know what your reaction is to this. Do you think that it's too little, too late? And what kind of impact do you think it will have on slowing the progression of the virus in Brunswick?
Every policy directed at limiting the movement of Canadians right now is going to be beneficial in New Brunswick, helping to curb the infestation of a variant. And so I have to be very supportive of this policy.
Merci beaucoup, Vicky Hogarth, CHCO-TV.
Thank you, Bruce. Dr. Russell, you said that the third wave could be the result of new variants and could be much worse. Is there evidence to suggest that the new strains of the virus might even be more life-threatening than the original strains?
Well, that's what we're looking into globally right now. So I think everybody's frantically trying to analyze the information that we have right now, including, incubation periods, severity of outcomes. Obviously, it's still new. So when we talk about having a reset, it's like learning a whole new virus all over again from scratch, because these are behaving in ways that the COVID we've been used to has not been behaving. So we do have some learning to do, and we'll be sharing our learning across jurisdictions.
Thank you, Ms. Hogarth. Marie-Ève Brassard. Natalie Sturgeon, Telegraph Journal.
Hi, thanks, Bruce. My question is for Dr. Russell. We've had one COVID death reclass applied in New Brunswick, and I believe you said earlier that there's another under investigation at Parkland St. John. What are the specific criteria and guidance under which New Brunswick Public Health is certifying and classifying COVID-19 deaths? And how, under that criteria, can a COVID-positive patient be declared a non-COVID related death?
So the cause of death is determined through collaboration of both the attending physician or physicians, if there's more than one, and public health. And New Brunswick follows the guidance from the Public Health Agency of Canada and the expert medical opinions to determine the cause of death for COVID-19 cases.
Thank you. Marie Sutherland, CBC.
Hi, this is not my question, but can I just clarify? You said 16 new cases, but it looks like the numbers add up to 17?
16. The news release is coming out. Your
Okay,
question,
so let's
please.
correct the cases in the zones.
It will come out with the correct clarification.
Okay, thank you. And my question is for Minister Shepherd. Horizon sent a memo to staff yesterday asking for workers willing to help out in Edmundston adult care facilities on Vitality's behalf. So given that Horizon has staffing challenges of its own, can you tell me a little bit about this plan? How many staff have responded? How many are needed? And if there are not enough, what's the backup plan?
So as you know, during during our COVID reality, there are times when some areas are involved in more of the COVID response than others. And as it is in Campbellton right now, we have, as always, as in a red zone or as this COVID progresses, our health authorities can be affected with staff being out due to isolation. Sorry, I said Campbellton, I meant Edmundston. So Horizon Health can better identify what their needs are, but as always, they put out their call for help. We had a call at 1 o'clock with our municipal communities, and we put out the same call that if communities have retired RNs, LPNs, personal support workers, and they're willing to help, we would be glad to have them. And it's a backup to our contingency plans, and we will always put those calls out when we think they're going to be necessary.
Thank you. Nathan DeLong, Miramichi leader.
Good afternoon. Thank you, Bruce. My question is for Dr. Russell. As of this morning, there were 295 more tests for COVID-19 conducted in Zone 7 than there had been last Saturday, January 23rd, since the pandemic began. Prior to announcing the changes to the orange phase and the fact that you won't be moving any zones to yellow anytime soon today, you folks have alluded to wanting testing to increase in Zone 7 before, giving more serious consideration to moving the zone back to yellow. I'm just wondering how much it needed to increase, in your opinion, before you consider that move, and if you're satisfied with how much it's increased, because it's still the lowest in the province in terms of testing rates.
Well, since the beginning of the pandemic, we have known that our testing strategy would be extremely important to maintaining confidence in us making sure that we could identify all cases of COVID-19 in the province as quickly as possible, and making sure that they're self-isolating as well as tracing their close contacts immediately. So the testing is really part of our success. So the more testing we do, the more confident we can be in the information around if we're catching all of the cases of COVID-19 early enough to make sure that they're not transmitting to others. This will become increasingly important with the new variants because we won't be able to stay ahead of it necessarily. So having whatever information about testing to be able to really assess what the picture really looks like and how accurate it is very important. So I hear what you're saying about, wanting the numbers to come up, and yes, that's true. I would like them to come up and stay up in perpetuity all around the province.
Thank you.
Thank you.
I'm going to add to that. We know this is a disappointment, but the fact of the matter is that when you have a house burning down, you don't leave the neighbor's house vulnerable. You protect it. And so that's what we're doing with Zone 7. We have got to be in orange for the foreseeable future in order to mitigate the risks that we know are coming. The same way that we locked down the province in March, we are taking serious measures today as information evolves on a daily basis we know that we have to respond. And that's why we are leaving Zone 7 in orange.
Thank you both.
Thank you.
Matthew Wacomo, l'Acadie Nouvelle.
Bonjour, Dr. Russell. Pourriez-vous mettre en mots, ou je devrais dire mettre des mots sur ce qu'on voit à Moncton et Edmundston dans les chiffres? Est-ce que ça s'améliore et à quel point ça s'améliore, à votre avis?
Je vais juste commenter que la zone 4 et la zone 1, ça continue à être les endroits du province qui nous inquiètent le plus. Je crois que ça va prendre plusieurs jours avant qu'on vous dire que ça va dans la bonne direction, puis on peut être plus rassuré que la situation est moins concernante. Alors, mais ça va prendre plusieurs jours pour déterminer ça. On continue avec des dépistages dans d'autres endroits, dans des foyers de soins, des résidences à long terme. Alors, chaque fois qu'on trouve des nouvelles cas, il faut faire le traçage de contact, et s'il y a des implications dans des entreprises, il faut planifier et répondre à les risques. Mais ça continue de nous concerner qu'il y ait encore des transmissions dans des lieux de travail dans les deux zones.
Merci beaucoup, M. Wacomo. Kevin Bissett, Canadian Press.
Yes, good afternoon. Thanks, Bruce. Question for Dr. Russell. Dr. Russell, can your vaccinators reliably get 6 doses out of the Pfizer vials? And I guess with that, how is your needle supply?
So up until now, they've been actually quite successful. I'm really proud of what they're doing. I don't have any information on the supply at this point, but again, the skill of our vaccinators right now, shining example of how to get that number of doses out of those vials. So kudos to them, and I do hope that they continue to be able to do that. But again, we have had success in that area, so I'm grateful for that.
Thank you. Timothy Jakes, Campbellton Tribune.
Yes, my question's for the minister. This came up at the Restigouche Regional Service Commission meeting last night. The province requires weekly tests for those crossing the border at Zone 5 for work. For people from Restigouche commuting to work in Quebec, apparently the nearest place to get tested is Dalhousie. That's a 40-minute return drive, not counting your time getting tested. And it requires an appointment, which could cause a delay. If that is so, why was a new requirement for testing for frequent commuters put in place before there were actually adequate testing facilities in place in the area so people could comply with it?
I would like to say that in any situation, we could bat 1,000 any day of the week, but we're going to stumble now and again. And I know that this is an agitation to many individuals. We are working on that as we speak. We will have a plan to roll out in the very early of next week to address this. And for now, this is about mitigating a risk. And the more people travel, the more at risk they are. And if I could liken it to the privilege of being able to travel, this is a necessity right now, and we understand some of the inconveniences that come with it. It is a necessity.
Thank you. Sophie Desautels, Radio-Canada.
Oui, bonjour. Ma question est pour le Dr. Russell. On me dit que vous avez eu une rencontre téléphonique avec les municipalités de la province. Est-ce que vous pouvez nous expliquer pourquoi et quelles sont les mesures que vous avez annoncées? Qu'est-ce que ça va changer pour les municipalités, la nouvelle zone orange?
Alors, chaque fois qu'il y a une zone qui va soit changer ou pas changer comme résultat de nos discussions et sur les risques, on essaie d'avoir des conversations, des discussions avec le leadership, les maires et les députés et les chefs des endroits autochtones pour chaque zone. Alors, aujourd'hui, on savait qu'il y avait plusieurs zones qui espéraient qu'on annoncerait des changements à la phase jaune, mais parce que les risques sont augmentés maintenant au niveau des risques des variants, Il fallait qu'on reste toute la province en orange. Et même après que les autres zones vont changer de phase de rétablissement, ça serait vraiment l'orange qui va nous protéger à ce moment-ci pour faire certaine qu'on pourrait donner tous les vaccins à les populations vulnérables d'ici à la fin de mars. Et on n'aura pas la capacité de recevoir d'autres doses, pas la capacité, c'est au niveau fédéral on est limité pour le nombre de doses de vaccins qu'on va recevoir dans les prochains 6 mois. Alors, c'est vraiment difficile de gérer les situations avec les variants à ce moment-ci. Alors, pour vraiment protéger toute la population à ce moment-ci, c'est pour ça qu'on reste dans la phase orange. Avec le changement qu'avec votre bulle d'un ménage, vous pouvez ajouter 10 personnes, mais il faut que ça soit les mêmes 10 personnes. C'est ça.
Merci beaucoup, Corinne Fitzherbert, Victoria Star.
Good afternoon. I'd like to know if any of the immunization clinics that were planned for First Nations communities has been affected by the reduced flow of the Pfizer-BioNTech vaccine.
Corinne, can you say it a bit louder, please?
Oh, I'm sorry.
No problem.
I'd like to know if any of the immunization clinics that were planned for First Nations communities have been affected by the reduced flow of the Pfizer vaccine.
Corinne, I'm not aware that any have, but I don't know that 100%. So we are going to have to get you that information today and get back to you very shortly.
Okay, thank you.
Savannah Odd, Brunswick News.
Hi there. My question, I believe, is for Dr. Russell. I guess I'm just hoping to get an update on what you had mentioned last week around the rollout for rapid testing. I know you mentioned there would be more emergency departments using that, and that there were discussions about using it in long-term care. So I'm wondering if and how those discussions have progressed or changed given this concern about such a transmissible variant.
So our plans for using rapid testing have continued to evolve, and we do have testing available at this point in time with the Abbott ID Now. So when we talk about rapid tests, yes, they're faster, but they do have limitations. So the most reliable rapid test is the PCR-based one, which is GeneXpert. We don't have a ton of supply of that. It is used in hospitals around pre-op testing and some of the long-term care facilities at the very beginning of outbreaks to identify cases very quickly. But that is in very short supply. We only get a weekly supply doled out by the federal government, as is the case across the country. So the new rapid tests are not PCR-based. They are antigen-based. They have limitations in that Health Canada has only approved them to be used for symptomatic people. So when you use them as a screening test for symptomatic people, it has to be within the first 7 days of the onset of their symptoms. So as soon as you start, and even then there are challenges with reliability in terms of sensitivity and specificity. So if somebody is a false positive, we're not too worried about that. It's an inconvenience, but it's not a safety issue with respect to spread of the virus. If you get a false negative, that means you're missing people, and those people can be out and about and infecting other people and transmitting COVID-19. So it is a bit of a risk. So as of right now, the Abbott ID Now rapid antigen tests are being used in emergency departments, I understand, and I'm just going to make sure I have those details. The rapid testing, the diagnostic testing, that's the GeneXpert. That's available in all of the regional laboratories. They will be able to be used, the screening tests, So the screening tests are available for people with symptoms, as I said, and even if they test positive, they will have to get a confirmatory test. And I thought I had notes on where they're all being utilized, but I actually don't. So I'm going to have to get that from our team and get back to you with that information. But we do have plans to use both of the rapid antigen tests in different settings, knowing that there are limitations to them, but we will be using them in different settings, and I have more information on that. I can get back to you.
Thank you. Harry Forrestal, CBC.
This is a question for Dr. Russell. Dr. Russell, well, congratulations on your one-year anniversary. The question I have is that from the very start, one of the fears driving the pandemic strategy has been to keep hospitals in the province from being swamped by COVID patients. Now, I'd like to know what you in public health are hearing about a drug called colchicine and its efficacy in keeping people who are infected with COVID-19 out of hospitals. And is New Brunswick taking any steps to include colchicine as a means of reducing that pressure on hospitals?
So Harry, I do have information on that in terms of the studies that they're referring to. We are talking about it still at the national level with Public Health Agency of Canada, so I don't have any new information around what New Brunswick could be doing at this point in time, but we are aware of that study. And again, we're still having conversations at the national level on that.
Tom Bateman, Brunswick News.
Good afternoon. Dr. Russell, you already kind of addressed the situation in Zone 1, but I wonder if you can just offer some more information about what your colleagues are seeing here in terms of the continued spread of the virus. I think people in this part of the province are kind of wondering what's different or what's going on here relative to the success we've seen recently in Zones 2 and 3. And if we don't have, kind of conclusive information on what needs to be fixed, then what kind of questions are your public health colleagues asking here? For example, is it possible the variant, is already a factor in the spread of COVID here? Thank you.
Well, when you look at the active cases in the province right now, there are 157 in Zone 4, and there are 74 active cases in Zone 1. So those are dramatically higher than the other zones. So still concerning. We would like to see the numbers go down. And as I mentioned earlier, we are still seeing transmission in workplace settings. Obviously the contact tracing with each new round of positive cases, there's another set of contacts to be traced. We're always relieved to see when the new cases are close contacts who are self-isolating at the time of their diagnosis. So that's always reassuring because we are doing day 10 testing on asymptomatic close contacts of people who are self-isolating. So some of the positive cases are because of that, and the sheer volume of people self-isolating, you're going to get some more positives from the people who are close contacts of those cases. So we do regular risk assessments on when we can safely return to a less restrictive phase of response, and we're not there yet in either zone.
That concludes today's COVID-19 update for the province with Minister Shepherd and Dr. Russell. Now, just for an update, I know there was a little bit of confusion at the start of the conference about how many cases there are today. There are, in fact, 16, and I'll give you the breakdown right now. The 16 cases, 4 are in Zone 1, that's the Moncton region. There are 2 in Zone 3, and 9 in Zone 4, and 1 in Zone 6. So sorry for the confusion at the beginning. I'm going to update our Facebook page so that it is correct on there. And there was also 1 death today as well. I'll be putting that on our Facebook page right after this with all the details. Thanks for joining today. I'm Vicki Hogarth at the CHCO News Desk.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.